Hello, Dr. Ryan here. I'm a board certified specialist internist. Thank you so much for joining me in this, our 71st episode in the OSCE series. We are putting you to the test. Testicular cancer is the topic for today. If you haven't yet subscribed to my channel, well, what are you waiting for? So, this is our case vignette, right? Or a typical illness script, if you will. A male aged usually between 20 to 40 presents with it has a history of a single undescended testicle, always a red flag. Presents with number one, dyspnea, cough, and a neck lump. All right. Supraclavicular lymphadenopathy, number two. Number three, bilateral dullness to percussion of the lungs, which probably speaks to a pleural effusion. Agophony, where the E sounds like A when you're listening with a stethoscope, right? And then coarse crackles. So look at this specific constellation of presenting signs and symptoms. Dyspnea, cough, and a neck lump. Supraclavicular lymphadenopathy, bilateral dullness to percussion of the lungs, agophony, coarse crackles. So the question goes, which specific additional examination should be performed? Testicular examination is the answer, right? So you must always consider testicular examination if you're dealing with a young male who may have evidence of metastasis, including things like supraclavicular lymphadenopathy, pulmonic consolidation, pleural effusions. The question you may ask is if you know that testicular cancer is the most common soft tissue cancer in males within this particular age group, especially if you've got a history of cryptorchidism, or if the patient had an oculopexy before, right? This scenario may include an alpha-fetoprotein level or a beta-HCG level. Both, if elevated, may allude to the diagnosis of testicular cancer, which are found in the actual majority of patients who have non-seminomatous germ cell pathology. They are not usually increased in seminomas. Okay. So how do we diagnose testicular cancer? Ultrasound and probably give us a clue together with the raised markers that we discussed. So raised alpha-fetoprotein, beta-HCG, lactate dehydrogenase. You might have to do a radical immunoarchaeectomy to determine the type of tumor you're dealing with retroperitoneal lymph node dissection, and a TNM staging. So you have to do some kind of imaging with a chest X-ray, CT abdomen and pelvis, and chest if you suspect pulmonary disease. How do you treat testicular cancer? Well, it all depends on the stage. Usually lymph node resection with or without chemotherapy based on the stage and functional status. So do your ECOG score and surveillance of tumor markers on physical examination. All right, my friends. Paul tells us in the book of 1 Corinthians chapter 2, verse 14, that the man without the Spirit does not accept the things that come from the Spirit of God. They are foolishness to him because he cannot understand them, because these things are spiritually discerned. It is the Holy Spirit that works in us to will and to do his good purpose. And the Holy Spirit reveals himself to those who fear him. The Lord reveals his promises to those who fear him and revere him and honor and love and respect him. That's why the things of the Spirit are foolishness to most people, because they don't reverence and fear the Lord. Have a lovely day, and I will see you soon. Here are my references. God bless.